We are still here in Ways and Means, and it is Wednesday, March 11th, 10:35. We are going to take a look at H 549. And Hillary, I don't think you've been here before, so nice to meet you. If you want to join us, thank you. Welcome to Ways and Means.
Thank you. Lovely sunlit room.
Sometimes.
Sometimes.
Mhm.
A little bit.
Never sunlit. We're looking at a black roof.
It
will be after the renovation.
There,
It's always bright.
brighter than some rooms.
It is. It's nice to be upstairs. So H 549, we would love like a high level, what is it? And then just like the pieces around the fees, if that works for you. And you're welcome to share your screen. Thanks.
Right. So for the record, Hillary Cheddar Ames for the Office of Legislative Counsel. This is draft 4.1 passed by House Corrections. Big picture, the bill proposes to provide individuals leaving correctional facilities with non-driver identification cards, replacement operators licenses, or replacement learners permits at no cost. So under current law, individuals who have been sentenced for 6 months or more can get a non-driver identification card upon release at no cost. But if they want a replacement license, it is at cost. And folks who are detained in correctional facilities don't have a mechanism to obtain any of these forms of identification. So the bill would change that in two main ways. First, for sentenced folks, they would be able to obtain replacement operators licenses or a replacement learner's permit at no cost. And individuals detained for 6 months or more would be able to get a non-driver identification card, a replacement license, or a replacement permit. The process works a little bit differently for detained individuals because DOC can't predict when they will actually be leaving the facility. So for individuals who are sentenced to 6 months or more, they get the card itself when they leave. But for individuals who are detained, DOC collects all of the necessary documentation. They give the documentation to the person upon release, and then they can go to DMV and get whatever card they are seeking.
In this current political moment, the word detained has, I think, brings up sort of a specific category of detained individuals, but I think you're talking about folks who are sort of incarcerated pending trial.
Exactly. So sorry, step back in justice system, professional world. Anyone who is being held in custody awaiting trial is referred to as a detained individual or someone who has been detained. So they have not been convicted of anything, but they have not been able to post bond or they are otherwise being held pending trial. That's not the norm in Vermont, but there are a number of individuals who are detained for various reasons pending trial.
Thanks. And I imagine the goal is that it's really hard to like get a place to live or a job if you are.
Exactly. I think the goal is to facilitate reentry in whatever ways possible, and having a valid form of identification enables a lot of daily tasks for people who are leaving correctional facilities.
Great. Thank you.
Can I ask for a little more clarification on definitions, and I'll give you a real example. Somebody who was detained and was bounced from state to state in detention and maybe ended up in Vermont and then was released, but has no ID, but their original ID might have been in another state. Did that person be eligible?
So generally this applies not to, for example, like the very few people that DOC has in custody subject to federal detainers or federal immigration detainers. It's generally folks who are in custody on state things. The DMV can only issue identification cards if there is proof of Vermont residence after release. So I think from the example you described, if the person were going to a halfway house in Vermont, if the person had some address they were going to afterwards in Vermont, part of what DOC does is provide documentation of the planned address upon release. And that's what they would give DMV. So as long as they could satisfy the requirements that DMV generally has for issuing these kinds of identification, then they could get an identification card, or likely not I think replacement license might be harder. It's because it's relying on having either a non-expired license or one that's been expired less than 3 years. It doesn't cover as many people. And if you don't have a recently expired or active license, then you'd have to retake a road test, and then you are outside of the replacement license category, and this would not apply. Does that help answer?
So
Or
if you were a federal detainee and you were released in Vermont and you moved to a halfway house, you would be eligible for one of these applications.
as long as you could provide the requisite documentation that anyone else would have to. Yep.
The bulk of this bill is about folks who are held under Vermont courts, Vermont law.
Exactly. I can say there was not much discussion or testimony focused on that particular scenario. But so the bulk of it was thinking folks who are detained on Vermont charges, state law charges.
Do you have a cost estimate of what this will cost?
Logan will talk us through that.
These individuals that are incarcerated, we're talking about US citizens, I'm assuming.
So it could be someone who is incarcerated or who is a US citizen or who is not. The kind of ID that you can get depends on whether you have proof of citizenship. So there are federal requirements to get what's called a real ID, which lets you cross the border or board a plane. And you have to show some proof of citizenship to get a real ID. If you do not have that or do not want to share it, you can get a non-real ID form of each of the kinds of identification, which won't let you cross the border or board a plane, but you can use them as proof of identity in applying for housing or other reasons you might want a card within the state. Does that answer your question or not quite?
Could you go over that again regarding the non-citizens?
Yes.
You could get a non-real ID card. Is that issued by Corrections Department?
It's all issued by DMV. So yes.
That's true. Current law. already.
Yes.
Yes.
Correct. So the role that DOC is playing here is a facilitation role. DMV remains the one issuing, reviewing, doing everything it currently does when anyone comes in to apply. DOC is playing a role to communicate to DMV which individuals in custody are interested in these forms of identification. And DOC does work to collect Vermont birth certificates or other forms of documentation that are required for someone to apply for either a non-driver ID card or a replacement license.
So we're not changing the law that we currently have on the books. And you're just, the Corrections Department is a facilitator, I guess, for the incarcerated person in helping that individual get.
Yes, so it's not changing anything about how DMV issues licenses. It's just providing for the certain group of folks that DOC will help facilitate getting them either documents or the card itself. And then the difference would be that it is at no cost. So if you, and I think Logan might be speaking to this shortly, but if you are, if I go to get a replacement Vermont license, I would pay I think $24. And so the difference would just be this expansion does it at no cost.
Could you tell me the vote of the Corrections Institutions Committee?
It was 1100.
Does the Department of Corrections facilitate access to those documents of people who are, so they would help the person retrieve the documents needed to get the documentation?
Yes, so they have a documentation specialist, I believe is the title, who testified before corrections and talked about what that person currently does to facilitate getting documents for the folks who under current law can get non-driver identification cards. So current law, if you are sentenced to 6 months or more, you can get the non-driver ID card. So that testimony indicated that They have tried but been unable to obtain birth certificates from other states. But they can get Vermont birth certificates if someone doesn't have them. And they help with providing the proof of address, which can be a little tricky when you are thinking about timing, leaving a correctional facility and housing.
But maybe this will be answered later on. Personnel, will we require additional personnel in corrections to do this type of work?
The testimony from both the Department of Corrections and from the Department of Motor Vehicles was that they did not anticipate needing additional personnel. I think the DMV has some limitations in being able to predict how many of these new cards they might be issuing, but on their understanding of the numbers, their testimony was that they would not need personnel.
Thank you.
Thank you so much.
Yeah.
Logan. Thank you for joining us. And thank you. It was great to have you in Ways and Means and welcome to the legislature and all the.
Good morning. For the record, Logan Miller at the Joint Fiscal Office. I have a very brief fiscal note on the bill. It'd be helpful to pull it up on the screen.
That would be lovely. Thank you.
Second. Perfect. So this is also on your committee page, also on the bill page. The first two paragraphs are essentially just explaining what was just explained to you, so I won't go through those again. The third paragraph there gets into some of the details related to this bill. So in 2025, or as you know, there's the current law where a certain subset of people can get the non-driver identification. Currently, in 2025, that was about 465 individuals received that for free. And then DOC estimates, well, they had numbers that between 2022 and 2025, there were an average of 46 individuals who would, based on this expansion proposed in this bill, now be able to get one of these identifications for free. So you're looking at 465 currently getting it, plus potentially 46 additional people getting this. Under current law, we have the fees there. The non-driver IDs have an application fee of $29. The replacement operator license and the replacement learner's permits have an application fee of $24. As was mentioned, the sort of fiscal impact of this bill is that those people will no longer be paying the associated fee when they get this. Again, it's an average of about 46 new individuals. So the fiscal impact is really de minimis on this. It'll be a few $1,000s at most. Yeah, and then that's what the last sentence basically just explains that, and says that will have a de minimis and fiscal impact, given the relatively small amount of people that this is applicable to do.
When it's time for them to renew again, on their own, they pay for
Have
that.
to pay it.
I just want to say, I think this is a great bill. It's unbelievable. Like I've worked with folks when they were leaving correctional facilities and trying to get their lives in order. And it's really hard. Like once you're sort of out on the street, it's really hard to get your documents in order and it's really hard to build a life without documents. Thank you very much.
Of course.
Anyone have any outstanding anything on this bill?
Madam Chair, I would move that we find H 549 favorable for the de minimis fiscal impact.
Thank you. Representative Kimball, how do I say your name? Move that we find H 549 favorable. Representative Brannigan seconds. Any discussion? Seeing none, if clerk could please call the roll.
Absolutely. Representative Brannigan.
Yes.
I'll vote yes as Representative Burkhart. Representative Higley is absent. Representative Holcomb.
Yes.
Representative Kimball.
Yes.
Representative Maslin.
Yeah.
Representative Odie.
Yes.
Representative Page.
Yes.
Representative Wazazak.
Yeah.
Representative Canfield.
Yes.
And Representative Kornheiser.
Yes.
We have voted the bill favorable, 10-0-1.
Who would like to report this? Great. Oh, sorry, that was Representative Wozniak.
I did the last correction.
Thank you very much.
I think it's de minimis.
Always a pleasure.
It's my favorite word.
Get
Um,
a small pleasure out of it.
they did find the thing that you lost. It's.
Perhaps.
Uh-huh. Okay, we are going to shift gears and pick up H 558. If folks remember, that is the bill related to Medicaid school-based services program and essentially moving the administration of it from the Agency of Education, where it has been, to the Agency of Human Services, who handles all other Medicaid billing in state government. And we are hearing from two business managers, and then if we have any questions afterwards, we have Ashley Berliner here from the Agency of Human Services who can answer any of those questions. So with that, Heather, hello, nice to see you.
Hello, everyone. It's nice to see all of you as well. And I have Nicole here with me as well. So thank you for having us. For the record, Heather Bushy. I am the past president of the Vermont Association of School Business Officials, and I am the director of finance for the Essex Westford School District. And I'm going to let Nicole introduce herself for the record.
For the record, my name is Nicole Lee. I'm the finance director for Champlain Valley School District.
Hi,
Excellent.
Nicole.
So nice to see Nicole in this seat. So I'm very excited to have her with me today in a different capacity. You should have our testimony. I submitted it this morning, but I want to just thank you all for the opportunity to have us speak on H558. We appreciate the legislature's intent to maximize federal Medicaid reimbursement and ensure compliance with federal requirements, and VASBO shares that goal. Medicaid school-based services are a critical funding source that support medically necessary services for students, including those with disabilities. However, while well-intentioned, it is essential to fully understand the potential impacts of this proposal on service delivery, operational capacity, and fiscal sustainability for school districts across Vermont before moving forward. At a time when federal actions are creating significant uncertainty in funding and previously enacted legislation is already affecting schools and communities, we urge you to exercise due diligence in understanding the full scope and implications of this proposal. We must be careful not to unintentionally restrict schools. Oh, sorry. Did somebody say something?
Okay.
Sorry. No worries. We must be careful not to unintentionally restrict schools' ability to provide critical services to students, particularly in regions that are already facing shortages of skilled professionals. H558 transfers sole authority over the Medicaid school-based services program to the Agency of Human Services and establishes a new reimbursement structure in which 55% of federal reimbursement is paid to school districts. That is an increase from the current 50% under current statute. And while it appears favorable on its face, the broader fiscal picture and the individual district impact is unclear to us. So key questions that remain for VASBO are: how will cost-based reimbursement be calculated under the new model? What assumptions were used in modeling district-level impacts? What does the modeling show for impacts by school district on Medicaid funding? Will funding be reduced based on the percentage of Medicaid eligible students in a district? And will all providers be eligible for cost-based reimbursement under the plan? For some districts, Medicaid revenue is a substantial and recurring source of support for clinician, special education, and intervention services. A reduction in funding, even a modest one, will be difficult to absorb and will inevitably increase pressure on the education fund and local taxpayers, which is certainly something that we don't want to be doing at this point. Additionally, there was a FAQ document that was put out by AHS that references a cost settlement formula that may require local education agencies to return funds on a regular basis due to overpayment relative to federal financial participation rates? If overpayment is anticipated, why wouldn't we adjust interim payments and calibrate them more precisely to projected costs? Regular clawbacks are just going to create budget instability and complicate local financial planning. The bill authorizes AHS to adopt rules identifying eligible services and participation requirements. However, we don't have details on who will be considered an eligible provider under the new plan, whether staff who are currently eligible to bill under the existing program may lose eligibility, what services will remain eligible, what documentation will be required for services to be eligible. Currently, special educators providing developmental and assistive therapy account for a significant portion of Medicaid revenue in many districts. We don't know if these will continue to qualify, and if not, the fiscal implications could be substantial. In addition, we must consider contracted providers because many districts rely on contracted providers for speech language pathologists, occupational therapists, psychologists, and other professionals. In certain regions of the state, providers choose to both serve students in schools and maintain their private practice outside of the school setting. Under current rules, once a provider reassigns billing rates to a school district, they cannot independently bill Medicaid. In cases where providers maintain external practices, districts often do not reassign billing rates. Instead, the district pays the provider at a reduced rate, and the provider bills Medicaid directly to be made whole. So how will the proposed carve-out ensure that healthcare provider shortages for school-based services decrease rather than grow? And if billing structures or reassignment requirements become more restrictive, providers may simply choose not to work in schools, further limiting student access to care. We also have some practical concerns, like how will contracted providers participate in random moment time studies if they're not employees? And where claim submission is still required, how will these claims be paid? On a typical healthcare timeline with explanations of benefits, or will they be held for quarterly interim payments? Currently, the AOE staff also provide critical training, technical assistance, and audit oversight related to school-based Medicaid. The FAQ document that was put out by AHS seems to indicate that school districts will now be responsible for adhering to and training staff on program integrity policies, including FERPA and IDEA data sharing requirements, and may need to conduct self-audits or desk audits. So while AHS and DEVA will provide instructional guides, this represents a shift in responsibility to districts, if I'm understanding the FAQ correctly. It seems to suggest that support is diminishing while compliance obligations remain complex. It would be our hope that the level of support currently available to districts under the school-based Medicaid program would remain intact as the program shifts to AHS. Medicaid school-based services are not a peripheral funding stream. They are integral to how many districts deliver medically necessary services to students, particularly those with disabilities. Any structural change of this magnitude must be accompanied by transparent fiscal modeling by district, clear definitions of eligible providers and services, a stable and predictable reimbursement framework, preservation of support and expertise in training and oversight, clear communication to LEAs on the changes that will be expected throughout the transition of the program, and safeguards against unintended service reductions in rural and underserved regions. We truly hope that the committee will gain a full understanding of the downstream impacts of this bill before advancing it. Our shared goal is to maximize federal reimbursement while ensuring that Vermont students continue to receive the services they need without shifting additional financial burdens onto local districts and taxpayers. I hope that your takeaway from this is that really how we are feeling, both from business managers in the field and special educators in the field, is that we really don't have enough detail on this bill to either support or come out against it because we just have not been provided with accurate details and information. So Thank you for your time and consideration, and Nicole and I are also happy to answer any questions.
Representative Woody.
When I hear this list, I think, okay. Would it be the role of the Agency of Education to sit down with this list and to figure this out? Is that their role, or whose role is that?
I think it's a good question. I think because of the transition, I believe it would be AHS. And I did have a meeting yesterday afternoon with Ashley that was super helpful. And we did offer to Ashley, both from a special educator standpoint as well as from a business manager standpoint, that we would be happy to partner with them to try and figure out the details of how this might roll out and the impact that it might have. And we did offer to provide any information that would be necessary in order to determine the district by district impact that this may have, because right now we don't know that. We know AHS has determined that they believe at sort of a macro level that this will be an increase, but have not been able to do the analysis district by district to determine what that will look like.
Oh,
And we
how
can hear from
long does it
Ashley
take?
after.
okay. How long do you think it would take for this to be? It sounds like a lot of stuff to work through with all the districts, so, I mean, I am loath to pass something that will further increase some cost to districts and confuse things and be very difficult for schools. At the same time that we say, well, this is how much we're giving you to run your schools. This is, you're making the choice to spend more than you're supposed to be spending. I have a problem.
I think, Representative Woody, I just want to recenter us on the goals here. It's to significantly reduce the work at the district level and sort of the friction around this fairly complex, historically federally complex billing, and to increase the amount of money we are drawing down from the feds, and increase the amount of money that goes to districts, because right now a lot of it goes directly to the agency and is not going to the districts.
Yes.
And so that's the goal. And so I hope we can work together with this business managers and AHS to work towards that goal of reducing work for districts and increasing money going to districts.
Yes.
Okay.
I don't disagree.
Yeah.
Between now and the time we have to act on this,
Yes.
my concern is what doesn't get done, and then, it's just hanging out there.
Yep.
For whatever period of time.
And so let's make sure that we're building in the assurances that are needed to make it work. Yeah.
Okay.
Representative Holcomb.
Hi, thank you for coming in and testifying today. Can you talk a little bit, you had a long section on eligible providers and services and raised some concerns around access to providers. Can you talk about that a little bit more, and also about what the consequences are if a district can't access a provider? What does that look like? And what are you seeing districts do in response to that challenge currently?
Yeah. Nicole, do you want to take that one?
So I think that it has historically been difficult in some of our more rural areas where providers are hard to come by, and districts have been they've been working as hard as they can to entice, that's the wrong word, but to partner with providers to ensure that the students who have a need have that need served. However, it is a little outside of the box, I would say, to have a provider running a practice and providing services to a different Medicaid provider, because the schools all have to be Medicaid providers to be eligible to receive payments. But I think that our main goal is really to say, like, we don't want to lose that out of the box thinking we have worked towards, and at the same time acknowledge that out of the box thinking has to fit within the Center for Medicare and Medicaid requirements placed upon AHS and then every provider who provides Medicaid services. So we don't want there to be a loss of services. And while we think we've been creatively solving the problem, if it isn't solving the problem within what Medicaid allows, then we're open to partnering with AHS and would actually enjoy the opportunity to figure out how we retain those services being provided as Medicaid eligible. I'm not sure if that fully answers your question, Representative Holcomb.
What happens if a school can't find a provider through one of the approved contractors?
Heather, I'm a little new to this role to be able to answer that.
Yeah, I mean, it's hard for me to answer that because, you know, being in Chittenden County, we tend to be able to fill those roles. So, you know, outside of going out to a contracted provider, I'm not sure how districts are creatively addressing those issues. To me, it seems like you're either hiring or you're going outside to an independent contractor.
We can ask Morgan to come in and answer that, if that would.
You should just answer it. They're hiring. Districts have to hire on staff.
Well, I think she also said that we might want to get some expertise from a more rural district, and I haven't seen Morgan in a while. It'd be nice to see him.
You will appreciate that.
Yeah.
And I will say just one other piece to that, and this is something that I was able to speak with Ashley about yesterday, is we also have paraprofessionals that are providing services right now to students. And so Ashley is aware of that and something that she is working really hard to make sure that we are able to retain the ability to bill for those services that are provided by our paraprofessionals. But again, I just want to bring us back to, you know, we have a lot of unanswered questions. It's hard for me to come in here and testify to you whether the current bill is going to accomplish all that we need it to. And we are committed to working and partnering with Ashley and her team at AHS to try and start to figure out these details.
Do you think by this change that your workforce will be reduced, or will it stay the same? Will it even increase? Have any estimate on that?
Yeah, again, like based on our very limited information that we have, our understanding is although payment will be delivered based on a random moment in time study, it won't be based on claim submission as it is today. We still have to do all of the same documentation that we do today to make sure that we have compliance with the Medicaid program. So I don't see how the work is reducing. It might be more efficient where with the electronic health record, instead of having paper forms, we may be able to have forms that are electronic. But again, based on my limited information, it seems like we will have to do the same level of documentation that we are doing today.
And
I think there's going to be a staff difference at the state level, but we can hear that from Ashley too.
And will you eventually go to electronic forms?
That is our understanding
whether
that
or not
part
we-
of this is the rollout of an electronic health record system that the state will be procuring. We don't know what that system is yet because my understanding is that contract has not been finalized. So that work will have to, you know, happen to configure the system. But yes, the vision, as I understand it, is moving to an electronic health record system.
Would that occur whether or not this bill is passed?
That would be a question that Ashley would have to answer, I believe.
Any other questions for the business commissioners? Yeah. Thank you both very much. You're welcome to stay for a bit while we hear from Ashley. And we're picking this back up again on Friday. I'm working on an amendment to make, the way sort of current law is structured, you're, tightly controlled in what you can bill for, and then you're tightly controlled in how you can spend your reimbursement. There only needs to be control on one end of that, not both ends, and so that's part of the amendment, but happy to add other pieces as you all work with AHS to find a, like, to make sure you're getting the assurances that you need on this.
Great.
Also wrong with this, but when you were talking about electronic records, that's expensive, and I wonder if we could request of our congressional delegation that they give us a per student amount to pay for something like that.
A congressional delegation?
Yeah. Yeah, the people who tell us all things that we have to do, not them, but Congress. They tell us what we have to do with all the rules and then suggest all the software that costs tens of millions of dollars. We need them to pay for the software.
But
I'm gonna ask Ashley to come join us. Oh, yeah, I'm sorry. Yes.
I'm so sorry, I mean formally.
Hey, let's talk about that later.
Thanks. I'm so sorry. One last question. Given, I understand this transition has already started anyway, and so it's in process. What's your assessment of the readiness of school systems to manage this transition in conjunction with other transitions that they face? And what might be necessary in terms of just operational support to make it possible to do all these transitions, but in a high fidelity way?
I think we don't know whether we're prepared or not at the moment, because we are very unclear of what is going to be required of us. The timing is set to be, my understanding is October 1, that this will go live for at least one cohort of districts. And having been in healthcare for 18 years and implementing an electronic health records, I think there is a good amount of configuration that will likely need to go into a system. Again, we're certainly ready to come to the table and try and figure this out, but I'm not sure that we really know what's enough detail to be able to answer that question on our preparedness at this moment.
So, yeah.
And just in that, I know there's been challenges around other big data reporting systems. How will this one be different? I know we struggle in the finance system. Are there other lessons that we should have learned that we should be putting front and center in this transition?
That is a great question. I think what I would say is having representation from the field participate in this process will ultimately make it a smoother process for everyone. And so my hope is that type of partnership will start from this point forward. Nicole, would you add anything?
I think I would just note that as we're adding a cohort of students, which is of course exciting and has the potential to provide us more revenue, that is a new bit of work for our clinicians. Not that they're not already providing the services, but if they're having to amend their workflows a bit to fit into Medicaid, just something to be aware of, that a larger cohort of their students they serve may require a larger amount of paperwork. And when I say paperwork, I mean electronic or physical paper.
One big difference I see is that AHS is managing this, not AOE. And so I think it'll be interesting to hear how they foresee it. Though, at the district level, it's work to be done. I think it's interesting.
That's a good question to ask the team. I mean, how has the AOE support for you been? For this process?
Right now, we have these regional Medicaid reps. I'm not sure that I'm getting their exact title correct, but so each district has a Medicaid representative from the Agency of Education appointed to them. And we interact with that staff member frequently. They come on site, they do training for our staff, they do audits and look at files to ensure that we are documenting everything appropriately. And from that perspective, our Medicaid reps, I think get a good amount of support from the Agency of Education. And that's just one of the pieces that was in my testimony, is I really hope that we're going to continue to have some support like that from AHS. But again, I don't know that that has been determined yet, what that will look like.
Thank you both.
Thank you.
Hi.
For the record, I'm Ashley Berliner. I'm the Director of Medicaid Policy for the Agency of Human Services. And I want to start by just thanking them. They have obviously given this a lot of thought and have raised really good questions. As Heather said, I did have a chance to speak to her and her special ed director yesterday, and we talked through a lot of this. We know that this is a big change, and we have a lot of work to do, and we are really committed to making sure that we are answering all their questions, that we are using them as thought partners. Our goal is to reduce the administrative burden, not add to it. And Heather's absolutely right that there are fundamental requirements of the Medicaid program that need to exist around clinical documentation. Those will exist in the new system as well. But we believe strongly that the tools and systems that we're setting up will support those processes and make it a lot more efficient than it is today. I also just want to bring back to the scope of this bill in and of itself. This bill transfers spending authority for Medicaid school-based services from AOE to AHS. That is the piece that is really at question here in this bill. There are a lot of other smaller things the chair mentioned. Some of the provisions around how schools are able to pay or able to spend the money that they receive. But the fundamental need for AHS right now is to get that spending authority in place so that we can take over this program. To speak specifically to the resource issue, we are extremely concerned about making sure that schools have resources that they need to implement these changes and then can carry them out in a sustainable way. And we're staffing accordingly. We certainly have a lot to do, and we have a lot of stakeholder engagement to do. And I'm so grateful that we have partners like this who are engaged and experienced and can help us really think through the issues that we don't have the appropriate perspective on. And we're going to be doing a lot of that in the next couple of months. Like, that is really where we're ramping up. But as Heather said, we're very committed to working closely with school districts and making sure that we're answering all their questions. We have answers to a lot of these questions and have not been able to fully disseminate them because of where we are in our contracting. We are not at liberty to fully engage the public in some of the work that we're doing to come under contract for our random moment time study system and our electronic health record system, but we're hoping to hit the ground running in April and really going to be ramping up all of that.
Representative, when did you first start working with VASBO?
We began communicating with VASBO last fall. Maybe actually that's not true. I'm sorry. We submitted a survey to them in 2024 prior to, fall of 2024 is the first time we formally engaged with them, but we started in the kind of current iteration of this phase more recently.
Did you get this particular feedback that they provided before you began the contracting process?
From VASBO?
or from districts, just generally?
We had multiple financial directors involved, and Heather was involved in some of the demonstrations that we had related to the electronic health record. We had a financial director involved in the scoring of our random moment time study. So I wouldn't say VASBO specifically, but we've been engaging school administrators on this.
Around things like the availability of staff and
Yes.
contractors.
Yes, and to speak to that specific question, Representative, we are very committed, and it is very much part of our core goal to make sure that we are not just maintaining the revenue that's going to schools, but increasing it, expanding access. And so that piece of making sure that providers that are being paid today can be paid in the future is a really big part of the work that we're doing.
Do you anticipate any, so I think there's one question about like, making sure that districts are sort of better off on the other side of this, or at least whole, in terms of the amount of revenue they're receiving. Do you anticipate any loss of contractor availability from this?
We're still working through, the short answer is no. We're still working through the mechanics of exactly how contracted providers will work. But it won't, we don't have any reason to believe that it will impact the availability of providers.
When do you expect that this work will be done? Will it be done before the next school session begins?
So again, this bill really focuses on providing spending authority to the Agency of Human Services. So a lot of what we're talking about is kind of outside the scope of this bill. The implementation of the random moment time study and the implementation of the electronic health record. The random moment time study will be implemented statewide on October 1st, 2026. And we're doing that because we engaged closely with the Agency of Administration and some early school stakeholders on the timing. And we heard from them that it would be very hard to train in the summer when they're all gone. And it would be much more favorable to schools to have them come back in the fall, spend the first couple of months doing the intensive training, which we'll be providing and our vendors will be providing, and then implementing on 10/1. So that's one piece of the puzzle. The second piece is the electronic health record. And that will be rolled out in a phased approach, starting on 10/1 with what we're going to call our early adopter cohort. This is a cohort that we have yet to identify, but we'll be doing in the next couple of weeks, who will be implementing the electronic health record first. And then we're going to be rolling out different cohorts over the course of the 26-27 school year to have full statewide adoption by the end of the 26-27 school year, by that June.
And if we don't implement this bill, you lose federal funding.
If we don't implement this bill, AHS will not be able to take over the school-based services Medicaid program.
But things will stay the same with the schools.
Which means that we're leaving money on the table, probably.
We're leaving money on the table, and we have serious concerns about the current administration. I met it, the last time I was here, I talked a little bit about the problems with the existing system, but we and AOE agree that the current system is broken and it really does need to be reformed. We have a lot of work to do to optimize that process, and none of that can happen if this bill doesn't move forward.
I have somebody talk about that because it sounds like they've already moved spending authority. That's already in process right now.
No.
You can ask Ashley the question.
What, I think a memo has already gone out signaling that you're moving forward with this, so I'm not understanding.
We need this bill to move the spending authority.
Can I ask two other questions? One, the first is one of the concerns that has come up in other conversations is around liability. And one of the challenges is that the district cannot find a contractor who's an approved contractor. They either have to put it on in-house or they are liable if that service is not provided. Has there been any discussion of moving that punitive liability over to AHS if AHS is assuming responsibility for deciding which contractors are permissible?
I think that's something, I'm not aware of that issue, so let me take that back and look into it.
And the follow-up question is, has there been any, I think we heard that there's some regional differences in terms of access and effectiveness of different strategies for working with available contractors. And one of the reasons that the regional shared services has been interesting in some areas is it gives a regional capacity to hold some of that talent and allocate that. Have you had any conversations around the potential of regional shared services to meet some of these needs?
Not today.
If implemented, will you be reporting back to, the AOE or AHS or even this agent or even this committee on your progress?
We'd be happy to come back and report on our progress at any time. We're working really closely with AOE. So even as AOE no longer is the direct administrator of this program, they will stay engaged. They have a Medicaid director, Medicaid school-based services director position there that will continue to be involved in the future state so that we're making sure we have those close connections with the Agency of Education.
So I've felt for a long time that this needed to happen. So I'm glad that it's in process. What was the impetus to get you this far without legislative authorization?
Yeah, it was those concerns we have for the existing administration of the program. We knew, we knew we were leaving money on the table. We know that we're one of the few states left in the country that hasn't fully implemented school-based services. We limit it to IEP services only right now. And so we want to expand that. In 2023, CMS came out with a lot of new policy guidance around how schools can expand their flexibility for Medicaid billing. And so taking that in, we really looked at our program, saw some things that weren't working and thought that it was a good opportunity to engage. At the same time, a federal grant became available. We applied for it and got it. And so we now have a lot of wind at our back where we have buy-in from both agencies. We have this new flexibility from CMS, and we have a few $1 million to drive it forward. And it's all been in support of where we are today.
So did you hear the list of concerns?
I did.
So are you also concerned about those things and are they workable?
I'm not concerned about them because I know we have answers to them. I'm concerned that we have so much work to do and need to really make sure that we're answering questions for those people in particular. Like, these are very important stakeholders. So we know that this is an aggressive timeline and are really focused on making sure that we can answer those questions as soon as possible. But that's a priority, is making sure we have that communication and thought partnership. But they're answerable and we're going to get there.
I agree with you that actually this is overdue. And, one of the things we talked about is that Vermont schools seem to spend about $2,000 more per kid on social services than districts and others. And I think this is probably a piece of that. I'm extremely concerned about the timeline and the aggressiveness of the timeline. It makes me very uncomfortable when you say you're not concerned, because I think you should be concerned, because this is rolling out right as we're about to upend districts across the state. It's not that this isn't good policy. I just don't know that people have the bandwidth to do it well. And my concern is that when we ram too much through a few people in a very short period of time without a lot of consultation, what we get is failed policy that looks like that policy. It was just good policy that we didn't plan for appropriate implementation. And we've seen that over and over and over again. It would be much more reassuring to me if you said you were concerned about implementation.
I am concerned about implementation. I'm not concerned about those questions that she raised. I am very concerned and extremely focused on implementation. It is an aggressive timeline and we are concerned about it. And we know that we have a plan to get there. I believe your question was about those questions in particular.
Don't interrupt, please. Thank you.
So those questions in particular that Heather and I talked about yesterday, that she presented here today, we have answers to those questions. So those questions I'm not concerned about. I am concerned about the timeline. Absolutely.
Can you add school districts? It's not just the AOE that needs to be consulted. And when I think of some of the big, huge projects that were good projects, and they're really done by wonderful people with the best of intentions, if there isn't hand-holding of districts through big change, particularly given what else is on their plates right now, my fear is that we will lose something that's really good.
Yeah.
That's all.
No, I think it's a really valid fear, and we are playing a little bit of catch up because this is not our bread and butter and have been getting up to speed. I think we're there. We're starting to hit our stride. We're aware of all the organizations. We're going to start getting on those monthly agendas. We have a really broad list of stakeholders that we're engaging on a monthly basis. We have an inbox that we're fielding questions from schools on a daily basis. So totally on the same page with you that the schools are our priority and our focus right now. I also want to speak specifically to the support that we're going to provide them. We are working with two different vendors right now. One is a change management and communication vendor that again is like just starting to get up and running, who's helping us figure out the right communication cohorts to make sure that we're engaging with the different professional organizations, that we're engaging with the boots on the ground. And that's a huge area of support that we have at the Agency of Human Services to make sure we're getting that communication out. We also are working with a vendor who is going to be hands-on holding and supporting the schools as they implement this, being able to answer technical questions, helping with workflows. Schools are going to be involved intimately in actually configuring the system. So we're going to be identifying at least 20 users to provide user testing and configuration. So all of this is really in service of the schools and the staff, and we have not lost sight of that. And it's a huge priority, and it is a massive lift. We fully acknowledge that.
Thank you very much, Ashley.
Thank
We're gonna
you.
pick this back up again on Friday. If you have any ways you would like to see the language change based on the testimony you've had today, please let me know, and same with the rest of the committee.
Okay. Thank you so much. Appreciate it.
We're gonna shift gears again, and we're gonna. Eric, I know I saw you, and I don't. Oh, that corner. If you could join the Zoom, do you have a computer with you? Oh, great, then don't join the Zoom. If you could just come join us, thank you.
Right,
Old
we were
school.
the same number of committees
Yeah.
this morning and got my iPad sent to history. And then Eric Fitzpatrick with the Office of Legislative Counsel, even funnier story. I just was sitting down in House Gov Ops for a minute thinking, when are they taking this up? I'm like, oh, in a committee. Because that's where this goes from.
Love that for you, Eric.
Yes, it's been one of those mornings for sure.
We have 841 as introduced posted. I feel like you also drafted an amendment.
Yes.
Which we don't seem to have posted. And I don't know if that's on me or where. I'm gonna figure that out in our email, but why don't you explain the bill?
Okay, or the amendment, sort of focus on the amendment. We've done the bill a couple of times on the walkthrough.
Yeah.
Yeah.
Oh,
That's,
great.
miscellaneous.
Remember that?
Or no, maybe I'm thinking of the animal cruelty bill.
I don't think we've talked through that.
We did the cruelty one.
Right.
Okay. Great. I'm glad I didn't forget that. Okay.
Right.
So if you could talk us through the bill fairly high level, while Saoirse and I look for the amendment.
Yes, absolutely. So the big picture here, you may remember that when you looked at the animal cruelty provisions bill, that was dealing with provisions related to animals in Vermont from the criminal perspective. Those were criminal provisions because animal cruelty is a crime, sometimes a felony, sometimes a misdemeanor. And we talked about how there were provisions related to forfeiture of animals when a person is convicted of a crime, that sort of thing. But statutes related to animals in Vermont are spread across a wide variety of places in the Green Books. And this bill, although also dealing with animal welfare, doesn't deal with crimes. This deals with the regulation of other things related to animals, such as the number of wolf hybrids, for example, the number of pets, the number of dogs that a person can keep. And in particular, a arm of state government that the legislature created last year, known as the DAW, the Division of Animal Welfare, which is in the Department of Public Safety. And the Division of Animal Welfare has a director of animal welfare, and they also have an associated fund, the Animal Welfare Fund. And one of the things that you may even remember that the bill that you looked at last time also did some amending to the Animal Welfare Fund. And that's one of the things that's going on in this bill, is that it decides kind of giving the Director of Animal Welfare some expanded authority and some additional obligations, which are on page 5 of the bill. So for example, this is the Division of Animal Welfare adopting rules for purposes of implementing a certified rabies vaccinator program. So this is a program that allows other professionals who work with veterinarians to also administer rabies vaccinations. Now, this has to be adopted by rule before it goes into effect. Also, this is bottom of page 5, Director of Animal Welfare is going to be required for anyone importing domestic pets into the state of Vermont for adoption, sale, or other to register with the Division of Animal Welfare. That's bottom of page 5. Over onto top of page 6. There's some associated consequences for someone failing to do this registration. And then you see the Animal Welfare Fund, and this is on page 6 over onto page 7. So this is an existing fund, existing special fund. And currently the fund consists of, so this is existing law, bottom of page 6, 60% of the revenue collected from certain surcharges, and those are surcharges in connection with animal welfare violations, registration of pets, that kind of thing, as well as number 2, any appropriations made by the General Assembly. And then over onto the top of page 7, you see the proposal to add 2 new pieces: any donations, grants, or gifts, and any revenue from the Animal Welfare Fund checkoff in Title 2032 of the tax code. And you may ask yourself, is there an Animal Welfare Fund checkoff? The answer to that is no, but the bill creates one, and that's why it's a cross-reference to the one that's created. The last couple of pages of the bill, pages 17, 18, 19, creates this Vermont Animal Welfare Fund checkoff. The reason I'm being so specific about that is because the amendment strikes that provision of the bill, the animal welfare checkoff. And obviously, if you're going to strike that, then you don't need this cross-reference because it will point you to the other piece that goes on in the amendment. If you look at page 6 of the bill, line 19, remember I mentioned that currently the welfare fund includes any appropriations made by the General Assembly. That's the existing law there. My understanding from Chris, and I could tell you about this in more detail, is that from an accounting perspective, appropriations is the wrong word. When moving money from one fund to another, the word should be transfers. So that technical correction is also part of the proposed amendment. And I think that JFO has been making that change whenever there's an opportunity to make it in existing law. So you have an opportunity to make it here because you're amending that section anyway. So that's why that technical piece is in there.
That was so fast, thank you.
Yeah.
Have folks' brains caught up, and does anyone have any questions?
In sum, we're removing the checkoff box.
And making a technical correction as well. But yes, those are the 2 things, and sums it up exactly.
Sir.
And unfortunately, I can't find it now. But there was some reference to animal cats outside. You know where I'm going.
I know where you're going.
And it looked as though the individual looking after those cats would have to have get them rabies shots and also maybe having them neutered. Is that a requirement? What happens if you are unable to do that?
Just asking for a friend.
Right.
Yes, I'm asking.
Well,
and I'll just tell you, I have stray cats around my home that I feed. Actually, my wife and I feed them, and I have managed to catch them and get them, but they are not inside.
They're hard to touch.
Absolutely.
So Eric, is that a change in requirements in there?
that piece, there was a large piece related to outdoor cats that was in the bill as introduced. That's gone. But you may be looking at, if you're talking about the sterilization of stray cats piece, is that what you're looking at? Page 7, line 6 to 11, basically.
It probably is. It did have to
That's
do
the
with.
part that remains with respect to stray cats.
But it also talked about making sure that they had received rabies shots. And that,
That, I'm not sure if that's still in there. There is the sexual sterilization piece, but that's an existing law. It's just a change in terminology.
Yeah, most of the bill is introduced on our.
Oh, right, it was in the bill as introduced.
Amendments up there too.
I think there's a bill in between the two, which was the bill as left GovOps, is what
Yep.
you're saying?
Yep.
You don't have.
Yeah, that one doesn't have that anymore. They got rid of that outdoor cat stuff.
okay.
Yes, thank you.
Does anyone have any other questions? We should hear about the fiscal, is there a fiscal impact? Great, thank you,
You
Eric.
bet.
Can you help Saoirse make sure she has?
I'll
Okay.
get it.
Cool, okay, great, thanks, okay, cool.
You want a doc number? Would that be helpful? No? Okay.
Thank you.
You bet.
Good morning, everyone. Chris Roop from the Joint Fiscal Office. This will be pretty brief. There is a fiscal note posted under my name on today's date that reflects the bill as recommended by GovOps. It does not recommend the decisions you all are contemplating today. So some of what's in here you will render moot, but it's here nonetheless. Bottom line up front, the bill really is not expected to have a significant revenue impact. We do expect that some of the provisions related to removing the discounted license for large breeders would have a minimally positive impact to municipalities and to the newly renamed Animal Sexual Sterilization Special Fund, because the folks who currently have the breeder license, which offers a discount on a per animal basis, would then be subject to the regular license system. So they would be paying on an average a little bit higher of a licensing fee. Most of that goes to the municipalities. It's really difficult for us to, we don't do fiscal estimates for municipalities as a rule. It'd be really hard for us to know this based on like what town different animals are in and where these breeder licenses currently are. But I can tell you that, for the overwhelming majority of municipalities in Vermont, dog licenses of all categories are like a low 4-figure fiscal impact to their budgets. So this is not, I think this squarely is in the realm of the de minimis. There's a few other things here I just wanted to point out that are of a fiscal nature. There's a requirement in Section 1 that when animal shelters, rescue organizations, breeders bring pets into Vermont for then sale or adoption, they have to register with the Director of Animal Welfare. She has indicated that they can handle that responsibility with their existing resources. We don't expect prohibiting a person from owning more than 35 dogs will have much of a fiscal impact on license revenue. And there's a lot of verbiage here that walks you through the ins and outs of who gets what in terms of the license fees and surcharges. But the bottom line here is most of the money flows to municipalities. There's a few surcharges that go to some special funds at the state level. But by removing that discounted license for the larger breeders, you would have more animals subject to the $4 surcharge. And then there's information here about the checkoff, which you all are proposing to remove. Just a little bit of historical context. We would expect that would generate likely less than $100,000 annually if it's stayed.
Thank you.
2%.
And we remove that, so you'll just.
Oh, yeah,
Okay, thank
a
you.
bunch of this will be stripped out in the next version of the fiscal.
Brannigan, to you.
Chris, I gasp at owning more than 35 dogs, but my question is, I do actually know someone in Manchester, sled dog races and competitions of various kinds. Those people tend to have more than 35 dogs, but from mine, I don't even have any way to make this opinion, but I'm gonna tell you, from what I can see, they look like they're well fed and they're cleaned and groomed and cared for. And so have you talked to those people and Are they involved in this 35 rule?
I have not, and Representative Brannigan, you win the record for the quickest legislator to exhaust my knowledge on a subject matter that I've been asked to testify on. That might be a great question for either Ledge Counsel or the Director of Animal Welfare. I don't know.
Or even just checking in with GovOps.
Yeah.
Yeah. I will say that people I know with sled dogs have fewer than 35 dogs, but, much fewer than 35, but maybe sled dogging is different up in Franklin County than it is in Adams.
I'm sure everything's different up in France.
It was sunnier.
Our staff's been ready for a while down by my way. Okay, Representative Maslin.
Yeah, last time you testified on this bill that,
No one's testified on this bill
It
yet.
was a different animal bill.
well, it still applies, but thank you. The last time you testified on an animal bill, which was fairly recent,
Mhm.
and you worked us through some fiscal implications. I learned a new term, which was indeterminate instead of de minimis. And so
Wow, yeah.
I've learned something new in this discussion. Thank you very much.
We're making a whole list of fancy multi-syllable synonyms for, we don't know, but it's probably really small.
That's good. Thank you.
Thank you very much, Chris, for those concluding remarks.
I'm sure I would suggest that based on the testimony we've received, that we pass or find favorable H 841.
I believe we have to amend it.
Oh, amended, yeah. Draft 1.1, the amendment for Ways and Means, find that favorable.
Thank you. Representative Kimball moves that we find the amendment favorable on H 841, and Representative Holcomb seconded. Any discussion? Seeing none, if the clerk would please call the roll.
Representative Brannigan.
Yes.
I'll vote yes, as Representative Burkhart. Representative Higley is absent. Representative Holcomb. Yes. Representative Kimball.
Yes.
Representative Maslin.
Yep.
Representative Odie.
Yes.
Representative Page.
Yes.
Representative Wazazat.
Yes.
Representative Canfield.
Yes.
Representative Kornheiser.
Yes.
We have voted the amendment favorable 10-0-1.
Thanks.
Need to move the bill?
Hmm.
Madam Chair, I would now find that, or suggest and move that we find the bill H41 favorable as amended.
Thank you. Representative Kimball moves that we find H 841 favorable as amended by the Committee on Ways and Means. Representative Holcomb seconds. Any discussion? Seeing none, if clerk please call the roll. Thank you.
Representative Brannigan.
Yes.
I'll vote yes, as Representative Burkhart. Representative Higley is still absent. Representative Holcomb. Representative Kimball.
Yes.
Representative Maslin.
Yes.
Representative Odie.
Yes.
Representative Page.
Yes.
Representative Wazazat.
Yes.
Representative Canfield.
Yes.
And Representative Kornheiser.
Yeah.
We have voted the bill favorable as amended 10-0-1.
Who would like to report that, including our amendment? Because,
The other one, I might as well do this one too, right?
sure, great, thank you.
But
Okay, thank you. Hope you will defend I hope you will defend our work removing checkboxes from forms. Thank you.
yeah,
I think then we are,
speaking, yes.
thank you. We are done for the morning. We are back here at 1:15. When we are going to talk about H 775. Thank you, Eric. Jim, please wait to send the email to the clerk's office before we leave so that it can get referred on the floor today. Thank you.
Great.